Okay. We'll get started with my kind of usual intro housekeeping stuff. Today we've invited Haleigh Kappel as a guest presenter here to share her recovery story. So I will get through this, and then we'll introduce her and let her kind of take it away for us this morning. Usual disclosure of relationship slides here. Everyone involved in the project has no relevant financial relationship to disclose or obligated to show this slide. Then our usual funding statement, we're funded by the State Opioid Response Grant, which comes out of the federal SAMHSA department. It comes to us by way of Nebraska Department of Health and Human Services. I think everyone here knows what Project ECHO is. I might just kind of skip this slide, but ECHO stands for Extension for Community Health Outcomes. These are ongoing trainings. Ours is focused on substance use disorders and pain. So we do these every other Friday trainings. And then we've also got consultations available from our hub team of 6 experts. So again, don't hesitate to get in touch with me if you would like to have a consultation on anything related to patients and substance use disorders and or chronic pain. Okay, and then just a reminder, where we are in this current series of 4 trainings. We're in the third of the 4 here. So a couple weeks, Ed will be finishing up this cycle of trainings with alcohol treatment in the outpatient setting. Then we'll be off in March, and then back again in April and May with another round of 4 trainings. And again, we're doing the certificates the same way we've been doing them this series, which is a new way for us. Still that same brief evaluation survey, and then I'll email you that certificate. It's a document that you're able to put your name and the date of the training in that yourself, and then you can save that, print it off, save it as a PDF, whatever. Okay, our expert panel. I'm going to stop sharing my slide here and let them introduce themselves, and then we will get to Haleigh. Let's see, Ed, would you like to go first?
Yeah, you bet. Hey, good morning, everybody. Ed Kaiser here. I'm a family trained nurse practitioner in Omaha, Nebraska. Excited to be with you guys.
Awesome. And John? Oh, you're muted. You're muted, Dr. Massey.
Good morning, everyone. I'm John Massey. I'm a pain provider in Lincoln and actually several communities in the state. And welcome.
Thanks. And Mary?
Hi, I'm Mary Ellis. I'm a psychiatric nurse practitioner and an attorney in the state of Nebraska.
Thanks. Todd?
Good morning, Todd Stoll. I'm a psychiatrist. Happy Friday the 13th.
That's right. That's right. Alex?
Morning, Alex Dworak. I'm a family physician.
Awesome. Thanks. So that's our expert panel, and we've invited our guest Haleigh to join us today. We feel it's important to bring on patients to share their experiences of recovery as part of this project. And so Haleigh joins us today to share her recovery story. I won't say a whole lot in terms of introduction for her since she's here to kind of talk about herself and share her story and her journey. I'll just mention kind of something about Haleigh's professional role. She's a peer support specialist at Centerpoint in Lincoln. So she shares her lived experiences. She develops relationships with individuals and kind of supports them in their process of long-term recovery and wellness as those patients define it. So her work involves kind of helping peers build healthy relationships, set boundaries, advocate for themselves, engage in healthy recreational activities, and find purpose. So she's turned her life experiences into some really positive work. But maybe that's all I'll say for now, and I'll kind of let you take it from there, Haleigh.
Hello.
Hey.
So like he said, my name's Haleigh. I work with Centerpoint. I've been there for about 2 years. So I guess I just kind of start with my story. I apologize. I have this on my phone. I had it set up on my iPad and then it was not connecting. So works from my phone.
This works just fine. That's all right. Yeah.
All right, sounds good. So just kind of starting off early childhood. I grew up originally, I had both parents. I was really close with my mom. When I was about 5, they started to have kind of struggles and they split up. My mom got into active use. She struggled with meth addiction. When they split up, it quickly fell to my dad to have the role of raising me. He worked in construction, so he worked a lot of hours. My mom's friend kind of helped out with that a lot. It was a very kind of up and down time for me because my mom started to become in and out. She was indicted for manufacturing meth when I was 5, I believe. And so then she was removed to federal prison. I went to private Christian school. I they did prayer requests every week, and so I kind of set myself up for being bullied early by praying for my mom and telling everyone at the school what her situation was. So school was not the greatest example for me growing up. I didn't quite fit in growing up with my dad or with the absence of my mom. She came back around the middle. Around my preteen years. She was kind of in and out right before that. My aunt passed away from her sister from alcoholism, and my mom was in and out of abusive relationships. When she was around, my dad would give me the choice if I wanted to be with her or if I wanted to be with him because I had missed her for so long. And I wouldn't tell him kind of how bad the situations would get when I was with her because I had spent so much time having her taken away from me already. So I would get to experience a lot of domestic violence in the home, a lot of fear for my mom, fear from our safety. She also experiences schizophrenia, so at times she would be running away from things that weren't there, and I would be running away from them with her. She moved to Norfolk when I was about the beginning of my preteens to go to treatment. She went to the Well, which was then the only women's dual diagnosis treatment center in Nebraska. I'm not sure if that's still current, but they have a bunch of different branches now. It helped her get clean for a while, but I was down here in Lincoln, so it was kind of off and on that I would get to see her. And when I would see her, there was generally relapses involved, and it still wasn't a very healthy dynamic. Her mom, I was very close with her mom while she was in and out of my life. My grandma got cancer. She had leukemia and lung cancer. That was really hard on me because with my dad working so much and my mom gone, I was really close with my grandma. I went to every chemo and radiation appointment. I would sleep in the hospital and I would walk to school. When my mom would get let out of treatment to try to come help my grandma, she would very quickly go into relapse and be removed from the situation, and that just kind of built more resentment. Um, when I was 15, my mom had my brother. That was when I finally stopped kind of idolizing her and finally realized that the drasticness of the situation and what my little brother was about to go through in comparison to what I'd been experiencing my whole life. Around that same time, right after that, my grandma passed away and my mom kind of went off the deep end. Initially, when she had him, she was living down here in Lincoln, staying with a relative. Um, right after he was born, she relapsed. This time it was on crack cocaine. And I was 15 and had to take my brother in her car and take them out of the situation. And then my dad was working out of state at the time. So when I went to go stay at his house without his knowledge, and obviously I wasn't letting anyone know what circumstances brought me to need to stay there, he ended up kicking me out for the summer because I was just making problems and hanging out with my friends in the house without supervision. So I got to go back to Norfolk with my mom for the summer. Um, Apologize, I'm a little bit anxious. I've got some pretty severe anxiety and ADHD, so I kind of jump around a lot. So I got up to Norfolk for the summer. My experimentation with substances had kind of began, but it was more of just kind of with friends. The pot eventually grew to some K2 use at the time, some occasional drinking, pretty much just kids always trying to get involved in whatever we could, but while also trying to stay away from the harder things we didn't understand. I also kind of very much disliked anyone that was involved with harder substances because of my mom's path. I didn't really see the overlap that I was leading myself into the same addictions at the time. um, so I was up there for the summer. It was pretty hard for me to not be with my dad, and it was just a bad situation. My mom was using the entire time. When I ended up leaving to go back for my senior year of high school, my mom immediately lost custody of my brother, and I kind of blamed myself for that because I had decided to go back to Lincoln for school. As soon as I well, let's see. So my senior year, I got expelled. I had gotten really bad into K2 at the time. I recently had gotten
I can't find, they'll find it in a
an
primary
aiding and
care note.
abetting charge that had put me on probation. So that had kind of moved my use from smoking marijuana to getting deeper into K2, which was really unhealthy for myself, especially trying to manage the fact that my mom had lost my brother and my grandma was gone, and I was just kind of not in a very good place. Um, I got expelled for part of my senior semester, and that was where I had the opportunity to learn that I did a lot better with schooling if I was doing it on a computer and it wasn't moving ahead without me paying attention, like what happened in classrooms, because I struggled to stay on track and retain everything when I was in a classroom setting. I was only there for, I believe, 2 months, and I finished 3 semesters worth of classes with straight A's in that time period, and that was the only reason I was able to graduate on time. When I graduated, I went to Norfolk again to help my mom take care of my little brother. I was moving down there. That was where I was going to start my life. While I was down there, I started working 2 jobs. I was kind of very much overdoing myself while also getting involved with some friends that were neighbors, just kind of hanging out in the party scene while trying to pay for everything to support my mom and my little brother. While I was there, I got into a relationship with someone that I had met at an NA meeting. I had just kind of started to attend for myself, realizing how bad I had gotten into K2. I had always been in the meetings because I kind of grew up with my mom always attending the meetings. So I was one of those kids running around in the rooms. Once I got there and I met this individual, we had an off and on relationship. And he ended up going back to his substance of choice, which was also meth. And then there had been an unfortunate situation where I did not handle it well. He had left with someone he had been cheating on me with, and I was looking for him. Well, I ended up hanging out with his best friend's girlfriend and another woman who were 10 and 20 years older than me, and we were all drinking and talking about where they could be. Well, we had gone to a man's house, and the girl that was 10 years older than me was going to sleep with the guy for money. We had ended up stealing the money from the man while she slept with him for money. It had been their idea, and they just kind of sent me to do it while they were doing whatever on the other end. I didn't even really remember the situation. I was incredibly intoxicated. When I came out of it, they had blamed the entire situation on me, and that was how I got my first prison number. It was a aiding and abetting, or no, I'm sorry, it was a theft by receiving. I had kind of been in and out of different types of probations at this point. It all started with aiding and abetting a shoplifter, and then continuously getting things revoked. I think I got put on drug court as a minor and quickly got kicked off of that just because I couldn't make it to the weekly court meetings across town, or the daily drug testing because my dad was always at work and we lived a good 25 minutes across Lincoln. I was never able to complete CBI. That was the last form of probation that I was on. When I got this charge, they charged me as an adult while I was in Norfolk and gave me 20 to 30 months in prison. When I got to prison, I had never been away from my parents entirely. It was definitely a different experience for me because since I was a minor, they did not want the adults to corrupt me. So they kept me in segregation initially for the first few months. Eventually, they decided to let me go to the substance abuse unit because it was a more controlled, monitored environment. While I was in there, I made some friends and we continued to kind of get into trouble, try to find various things we could try to find to get under the influence of. And well, never succeeding at getting under the influence at all. But just seemed to be trouble. I was kicked out of the substance abuse unit. I was kicked out of it twice, I do believe. The second time I was not actually doing something wrong, but because I had been involved in doing something wrong the first time, I was guilty by association. They told me that I would not be able to parole. So at my parole hearing, that was one of the only times I've seen my father cry when they told him that I wouldn't be getting parole. It really affected me because my dad's a construction worker who is now a truck driver, and I probably can count on one hand the amount of times I've seen him cry. just realizing how much I was hurting my family and hurting myself, because I hadn't even really taken a look at that point in time. Just really started to open my eyes. So I went back in there and finished out my prison number. They did tell me briefly that I was going to be able to go to work release, but it turned out because of one of my write-ups that wasn't going to happen. So they packed me up to bring me, and then changed their mind on that. I jammed from prison, no parole, in May 5th of 2015. I got out and I went right back to Norfolk because I felt I had to go and take care of my brother. I started back with 2 jobs. I had been installing floors before I went to prison, and I had been working at Braun Research. Both jobs were quick to take me back as soon as I got out. It was May 2015 when I got out, and June of 2015 is when I injured myself on the job. I was installing floors. I was tearing out a concrete floor and I struck the ground wrong. To this day, I'm not entirely sure what happened. All I know is when I struck the ground, I immediately fell to the ground in pain, and I couldn't move, and I was screaming, and they took me to the hospital. They did an x-ray there. They were unable to find anything. Months later, I was still having the pain in my shoulder and neck that just kind of seemed to spread. I had multiple scans, MRIs, continued to see doctors. There really wasn't any answer for what was wrong with me. It was July of 2015 that I tried meth for the first time. I was just around some friends that I had known for a long time, and even though the one I was with knew I had a large problem with it, he had fallen asleep and his friend had kept suggesting it to me, and I'm not sure what changed that night because I had spent my entire life hating anyone who used meth, and then all of a sudden I decided to try it. My entire life changed very quickly that night. I stayed up for an entire week. I didn't eat. I think I had the same bottle of Mountain Dew the entire time I was using. When I came down, it was very hard, and I felt miserable, but I was very quick to end up with the same people and making the same choices. I was living in a house when I got out of prison that was kind of 6 of us rented a room, and it was kind of college age people. So I really knew 1 or 2 people that lived there. Well, it turned out one of my new roommates I didn't know was also into the harder things like I was, even though the rest of the house was not. So we ended up kind of hanging out and sneaking around doing that on the weekends. It gradually kind of grew to a more often thing after a couple of months, and I decided, oh, well, I should probably stop. This is, getting a little bit out of hand. I managed to stay clean for 2 months. After I stayed clean for 2 months, I ended up getting back together with the same ex that I had been with before I went to prison, the one that I had been looking for the night I ended up going to prison. And he was actively using, and so I ended up quickly starting to use with him, and that was November of 2015. I believe it was December 19th, 2015, that me and that the same individual were arrested together. I was 100 pounds. Right now, I am 150, so that's 50 pounds less than I am right now, and I'm not a particularly large person. I feel like that was the closest I've ever been to death. I wouldn't eat anything. I would not sleep for over a month period. It just very quickly, it filled a lot of things for me. It numbed me. It gave me the ability to not need to sleep. And I've always kind of struggled with nightmares and not doing well. It just kind of resolved a lot of things for me. I didn't realize then that I was trying to treat mental health that, like, now I understand with my extreme ADHD, meth was really the only time that my thoughts stopped suffocating me and going a million miles an hour. I was lost, and I fell into it very quickly. After we got arrested, I just got a possession charge. I was in there for maybe 2 to 3 weeks before I bonded out, and then I stayed sober for another week or 2, but then I quickly relapsed again. I was arrested for a second possession, March of 2016. I was in there for a few months. I believe it was July when I got out. I was sentenced to drug court, so I was going to have an opportunity to get these charges off of my record and change things. One of the charges I felt like I could have fought and gotten dropped, but I wanted to change my life anyway, so I was planning to do the deal anyway, and I was ready to start that. I got to get out, and I went to Sunrise Place in Norfolk. It's a 30-day inpatient treatment. Um, while I was there, it went really well for me, but also at the same time, felt like all those emotions I hadn't really been dealing with started crashing down around me. Someone I had been close to, well, actually, someone I had been close to had a daughter that I was their godmother, and the mother was not around anymore, but her dad, the daughter's dad, was, who I had not known previously. That person is still a good support in my life today, but at that NA meeting while I was in treatment, he finally told me it was okay to not be okay, and that allowed me to finally kind of let everything crash down and start feeling things and start working on things. That wasn't a grace I had ever really allowed myself before, it being okay to not be okay. All I knew is I was never okay, and I was trying to bandage it with something or other the entire time. Um, I got out. I was on a pink cloud. I was very excited to start my life. Um, Figured out really quickly that it was not quite so easy to get on your feet after you had been messing up your life for quite a while. Nowhere wanted to hire me with my background. Nowhere wanted to rent to me. Um, Nowhere. It just was everything. Every stop I met was with resistance. I also was getting in trouble with drug court because I would not change my friends. I did well with stopping using entirely, but I didn't see the need to change my friends or my activities. So I finally did find a place that would rent to me, and I found a couple of jobs that would hire me because I seemed to always go right to the 2 full-time jobs thing. And I noticed when I was kind of writing the note cards for the outline of what my story looked like, up until now, currently, where I have one job, it seemed like it was always 2 jobs if I wasn't using substances. That was when I started getting more into physical therapy, and seeing more doctors and having more MRIs, that I still wasn't getting really any information on what was wrong with me. Um, I continued to kind of get in trouble while I was on drug court, just for the fact that I was still hanging out. Whether it was active users or people on probation, I was just constantly getting sanctioned for kind of the same thing. Um, I had started dating an individual I had met at NA who was on probation that I continuously got in trouble for being around. I ended up self-terminating from drug court. Uh, I had, I believe, 2.5 years clean at that point, but I just knew, I felt like they had started me all the way back to phase 1, and I felt like I was going to continue to get in trouble for hanging out with the individual that I was dating at the time. And so I just didn't want to waste anyone's time or my own, and I asked to be terminated. Um, in the time before I got sentenced, I didn't know if I would get probation or if I would go back to prison. But I didn't want to have anyone telling me I couldn't be with the individual I'd been dating for the past year, so we decided to get married. Um, Definitely not the brightest reason to get married, but we thought we were in love and we rushed into that. We also tried to move down to Lincoln. That way I would kind of be away from Norfolk, because I had long ago identified that that was a pretty bad place for me. I just ended up there trying to take care of my brother. After we got married, I do believe I had sentencing the next day. Oh, something I forgot to mention. My ex-husband, well, now ex-husband, the gentleman that I married, he had gotten some charges before I had quit drug court. So that was part of why they had been saying I could not hang around him. Um, after right after we got married, I had sentencing the next day. I got 12 months of SAS probation, which is pretty unusual because the county attorney was recommending prison, but the judge that was on my case was aware of how long I had been clean and how much I had changed things, even if I had consistently kind of been in trouble off and on. He wanted to give me another chance and give me a low amount of probation. While I was on probation, the next day, I believe, my husband got sent to a treatment center. And as soon as he got out of the treatment center, he was sentenced to a few years in prison for his 4th offense DUI. So pretty much immediately into our marriage, we were separated. I was down here in Lincoln. I was back living at my dad's. I got a job at Tractor Supply, mainly because I heard they had some good insurance. And I was wanting to get my neck and shoulder looked at. That was just still constantly just making me completely miserable. While I was at my dad's, and while I was at Tractor Supply, I started seeing a pain specialist. We went in pursuing ablations in my neck. We did a couple of ablations. It seemed to give me a greater range of motion, but my muscles were just so tense that I was unable to make them relax. After the ablations they somewhat worked, but didn't work to the full extent. We decided to try Botox in my neck. The first round of that, same results, somewhat helped, but also was not to the extent that was desired. So we tried that again. This time it seemed to kind of give me too much Botox, and so I was unable to support myself. I would stand at the cash register at Tractor Supply at that time, and I could only stand for like 5 minutes before I would start to get lightheaded and feel like I was going to drop. It seemed like the Botox kind of numbed certain muscles, so all of a sudden muscles that had never had to do anything before were what were responsible for supporting me. I spent a lot of time in the back of Tractor Supply laying on bags of dog food because I just couldn't continue to even sit up and support myself anymore. After a month or two of it just kind of continuously getting worse for me, I ended up going on short-term disability because I kept having to leave work. After I ended up on short-term disability, I was still at my dad's. My ex-husband was still in prison. He went right to work release, but it quickly ended up just kind of like how it was before with me clean and him still trying to find any way to use. So he was at work release, and he would find different things that he could use that wouldn't show up, such as like kratom or these things called potions that they sell at like Rexius Nutrition. And he would basically argue with me to the point until I cried, just telling me that I needed to bring them. We were talking about trying to have a baby at the time, and I did not want to be having a family with someone who told me they wanted to get clean with me, because keep in mind at this point I have like 3 years clean. Get close to 3.5 years clean. And I just was not doing very well with it. I ended up having an affair with my best friend when I was on the phone with my ex-husband, and I told him that he needed to make a decision between me and the substances, and he told me he would not make the decision between the substances. I just needed to bring the substances, and he would see me when I got there. The guilt from me having the affair, I did not know how to handle it. I am a very honest, well, at that point, I was becoming a very honest person nowadays, and I did not like anything about the way it made me feel. I relapsed. I threw away 3.5 years clean, and I left my ex-husband the same day. I disappeared from Lincoln and went back to Norfolk, which was also where my best friend at the time had lived, and he had also started using again. I was up there and I was using, very quickly found out that I tried to be in a relationship with the friend I had mentioned, and it very quickly ended up toxic, little edged on violent, along with him just making some pretty poor choices, and we separated pretty quickly. I didn't know how to handle that. I just kind of felt like I had lost everything. I had left my entire life behind, everything I had built for 3.5 years. The pain was just unbearable all the time in my shoulder and neck. My brain was just a complete haywire mess. I left out when I was about 15. I started to get diagnoses that have evolved. Initially, it started off thinking that I was bipolar 1, but since has evolved to I have ADHD. ADHD and extreme anxiety are the overleading ones, along with there goes the ADHD, forgetting what I'm talking about. OCD, PTSD, and probable autism. My psychiatrist did not specialize in that, so he was not sure, but he was pretty sure about it. And when I watch, now that I've studied symptoms of it, and I watch my 3-year-old that I have now, I don't have a lot of doubt that we have a lot of symptoms in that category. But I didn't know what I was navigating with my mental health. I just knew that I had never been okay, and now I was back in this black hole that I dug myself in. I initially went back to my mother's because she was also actively using again at that point. Very quickly, we began to clash, and I didn't want to be in that environment. So I just decided I wanted to experience homelessness in my car and just kind of stay there and distance myself from everyone, because everyone in my life, I felt like it hurt me, and everyone was always going to hurt me. I continued to just get deeper and deeper into the substances, and deeper into my own mental health, not doing well. I pretty much, when you're in the active using lifestyle, there's a lot of people making poor choices that are hanging around with you. So my stuff continued to kind of get stolen by people that I thought were my friends. And my car at the time had gotten stolen and was used in a hit and run accident where the person left the license plate at the scene. And then I found the car. I, at the time, had a warrant for driving under suspension out of Lincoln. And so I was terrified to be in the car, but I could not leave the car because everything I owned was inside of it. And everything had been getting stolen. So I just kind of was almost in this psychosis that I could not leave the car. I could not be in the car. And it just built to hysteria. And I had decided that I needed to end my life because that was the only option to trying to find a way out of that situation. I didn't. I still had family members that I had rebuilt relationships with before that still loved me, but I just knew that I was disappointing them and I was hurting them. And I didn't think that I thought they would all kind of be better off without me. Part of me did want to go to treatment. You know, something about having 3.5 years clean when you have a lot of recovery, it's you kind of just your own head is not your friend. It kind of tells you, you know, you shouldn't be doing this. You know better. You blah blah blah, and it's just it's not easy to get high with all that recovery in your head. So part of me did want to go to treatment. I was talking about I'll get clean next week. I kind of continued to say that for I don't even know how long. It ended up being made a decision for me. I had been high for 8 months back in Norfolk. Then all of a sudden, Lincoln decided they wanted me on my driving under suspension warrant that I had had for months. What that had really meant was the investigation they had been doing on me had ended. I had had 3 wires worn on me. I was selling a small amount of substances. It wasn't really that I was active in a drug dealing role. It was more of that my friends and I would combine our money together to get sacks, and those people were not my friends, and ended up wearing the wires on me. The wires were worn by someone I called my best friend and someone that I called my brother. He was not actually my brother, but we were very close for pretty much all of my years in Norfolk. After my arrest, I did not realize I was in there on quite so many charges. They didn't tell me that right away. I sat in there for a week. I knew I had gotten another possession charge because when they arrested me, I had had another pipe on me. So I sat there, and then when it came time for arraignment, I got my papers, and someone asked if I had any other charges, and I said no, and they flipped my page, and it said delivery, and they flipped the page, and it said delivery, and they flipped the page, and it said delivery, and every delivery is worth 1 to 50 years. So I was sitting there, and I realized I was facing 3 to 152 years over 2 oxycodones and 2 grams of meth and a pipe. And it hit me. I was in a really bad situation. I was looking at facing the rest of my life in prison. I sat in there. I was in there. I was arrested May 23rd. Well, no, I was probably arrested May 22nd, 2019. I had some substances on me when I got arrested that I concealed and then used for the first day that I was in there. So my clean date is May 3rd of 2019. I was able to get out, and I was able to go to the Well, that treatment center that I was talking about that my mom had attended the previous year, or many previous years ago, and many times since then. My mom was also currently attending the Well, so we were the first ever mother-daughter combination to be at the Well at the same time. Thankfully, this was the same time that the Well was opening one of their new houses, the IR house, intermediate residential. And because my mom and I had always kind of experienced some conflict, I was able to advocate for myself to get moved to the other house. I was able to graduate that program. I was there. I probably didn't do the full 6 months. It was probably about 4.5 or 5. I know I had about 9 months clean. I had sentencing in January of 2020. Right before sentencing, I had been somewhat seen. There was one friend I had when I was using that was pretty much the only person who hadn't hurt me or stolen from me and just kind of seemed to protect me. So that person's still in my life today. Kind of a trauma bond situation is how it started, I would say. But right when I got clean, the same person had worn wires on us both. And we both went to jail at the same time, and we both got out to go to treatment at the same time. He ended up not doing well and ended up going on the run. We had ended up sleeping together right before that, and I was pregnant. I was very afraid. I had sentencing in 11 days. The individual, at this point, I was facing 0 to 42 years with the plea agreement I had taken, but 0 to 42 years is still a pretty large gap on what I could have been facing. Um, my I ended up going to sentencing shortly after when I went to sentencing. My lawyer told me he had never seen such a turnout in a courtroom. The entire Madison County courtroom, half of one side was filled with supporters from NA, women in the program, women I was in treatment with, my family members. I was able to go and I was able to get 3 to 4 years. Well, on both charges, so 3 to 4 years on each, run concurrent, so run at the same time. People had been very hopeful that I was looking for probation. I knew that wasn't very reasonable with the fact that I had been to prison before and I already had multiple felonies on my record. But I got out and I did really good that whole time I was out. It seems like I'm one of those people that I'm a very all or nothing type of person. When I do good, I do great. When I mess up, I mess all the way up. And it's like just 0 to 100 all the time. I don't seem to know it in between. So I got sentenced in January to 3 to 4 years. I went back to York. I was having a lot of complications with my pregnancy. I just had some spotting, constipation, a variety of symptoms that I didn't feel like were right, but I'd also never been pregnant before, and I had a lot of life stressors going on. I continued to try to advocate for myself with the prison about my spotting. March 14th, it was right before, I believe, everything kind of shut down for COVID. It was also my current boyfriend, the individual that I was pregnant by the first time. It was his birthday. He was in jail at that point. He got, I believe, half of the time that I got. While I was in there, I advocated that I was not feeling well. They did take me to the hospital. They did an ultrasound. The baby was fine. I had a little bit of spotting. They did a urine test. They didn't get the results back until later that night, but it turned out I had a urinary tract infection, and I don't know how long that I had that. But that night I got brought back to the prison, and I got brought back to the prison and I was not doing well. I immediately went back to my bed. I was also back in the substance abuse unit, even though I was trying to inform them that I had 9 months clean and I had just completed a long-term inpatient treatment program. I also had a roommate who was someone I knew from Norfolk who had been threatening me and my safety. And I knew by her record that she had multiple assaults on inmates. So I did not doubt that if I made problems about the situation that would happen. So I just kind of stayed to my own corner the entire time that I was in there. When I got back to the room that night, I was drenched in sweat. I couldn't get out of bed. My teeth were chattering so hard from shivering that I felt like they were going to break. All of my roommates were putting blankets on top of me because I just couldn't stop shivering. I was still spotting. One of the guards finally realized right after dinner time that I was not okay and I couldn't even sit up or stand up or walk. So I was brought to medical in a wheelchair. I was pale. My heart rate was bad. Well, it was low. All right. I can't remember the exact. I can't remember if it was low or high, but I know it was off. And I know I could barely even speak. The sheets I was wrapped in were entirely soaked from my sweat. I asked them to take me to the hospital. They were basically like, well, no, we took you for an ultrasound today. You were fine. We're just going to put you up in medical for observation. So they put me in medical for observation. And while I was in there, they did not really, they came back to check on me once and get my vitals at 10 o'clock that night. What I feel like proceeded to happen after that is preterm labor. I had not had any experience of labor before that, but I know that I would have a wave of pain that I would pass out after every single one of them. I would kind of writhe on the bed in pain, screaming, and then after every wave would pass, I would pass back out. That went on from 10 a.m. until 7 a.m. when I lost the baby. After that, I just kind of shut down. But also before that, I had been in a pretty long-term debate on if I was going to keep the child or not, on if I was going to give it up for adoption or if I was going to keep the child. due to my own experience with my mother, I did not want to keep the child if I thought there was any chance I was ever going to get high again, because I could just never ever do to my own child what my mom had been doing to me my entire life. Um, after that, I kind of shut down. I was still had a long time left in prison. My family was not able to visit me. That with them shutting down the world, they stopped allowing visits. They stopped allowing church to come in. They did allow one chaplain to come see me and the head of the mental health to come check on me. And at that point, I was able to advocate, hey, I just did long-term treatment, so I finally got SAU off my plan that I had been trying to get them to remove me from for months. Shortly after that, I got to go directly to work release. I got to work release at the same time as the person that I'm still with today, the child that I lost's father. Um, we got there at the same time. That is when we began dating. He got out a few months later, and I still had half a year left. I worked at Kawasaki during that time. Um, when we got out, we moved right in together, and I got pregnant pretty much as soon as I got out of work release, and at 5 weeks, I miscarried that baby as well. Um, and then directly after that, I got pregnant with my son. I don't even think it was a week. It was Mother's Day that I miscarried, and it was less than a week that I got pregnant with my son. He just turned 4, February 7th. So I got out, and that is when I was trying to figure out. I had my son. I was very scared the whole pregnancy. I obviously I'd had 2 pregnancies that had not gone very well. I also was having a threatened miscarriage with my son. I was still having the spotting that I experienced with the other pregnancies. That was when I stopped the kind of higher job duties I was doing, and I found a hotel desk job where I could just sit overnight and not have to do anything strenuous. My doctor didn't want me working, but that just wasn't really reasonable to being able to afford rent. Um, I was able to carry him to full term. I was induced on February 7th. Um, After he was born, it pretty much changed my whole world for me. I was kind of worried before he was born that I didn't really have the maternal instincts. I was just kind of detached the entire time. I think that might have had something to do with maybe the previous miscarriages and just not wanting to get attached until the baby was here. But he was born and he became the best thing ever. His name is Trace, because third time's the charm. Um, After that, I went and worked at my grandparents' campground briefly because I was able to bring him with me to work. And then I went back to Kawasaki because I felt like that was the best financial decision. Um, I worked at Kawasaki also while I was at work release. That was a really bad decision for my bad shoulder. When you're in pain, it feels like every minute is an hour, and I would work overnight. I worked there for 7 months, and I only missed 2 days, I believe. And every night I would just wrap my upper torso in an ace bandage because my shoulder blade would kind of wing out to the side as soon as I would go to work. And that was the only way I was able to stand throughout the night, was by basically putting my shoulder in place. Um, it just kind of got worse and worse. There never has been any break for the pain. When I got out, I started another round of physical therapy. Also started some dry needling. I've seen chiropractors. I've seen what we did come to the conclusion of. I finally have gotten somewhat of an answer. It seems that groupings and groupings of trigger points have developed underneath my shoulder plate, and they have just kind of gradually spread. So I can't, probably at least 50 trigger points between underneath my shoulder, spreading up my shoulder, along the tops of my shoulder, around the back of my neck, along my hairline, down this side. I also was looking at an MRI result that I had back in when I first started pursuing results. It says that I have a slight annular bulge and disc protrusion in the C3 through 7 discs in my neck. Which, even though a bunch of doctors have seen that MRI and they told me that that could not be what causes all my pain, when I copy and paste those findings into Google, it lists off every one of my symptoms. Not that I think Google's an actual doctor, but I do find that curious. And I continue to see doctors. I'm still doing chiropractor along with getting trigger point injections. What seems to make the most difference is if I can get trigger point injections along with trigger point massage, which both are fairly pricey. So I do get those, but it's not nearly enough for what I would need because the trigger points pretty much just regenerate every week, really. So I try to navigate that. I finally started working in peer support a little over 3 years ago, actually about 3 years ago, exactly in January. I started off with Mental Health Association. I was working in the REAL program. That stands for Respond, Empower, Advocate, and Listen. The way that works is law enforcement will send referrals, and then I would show up on your doorstep and I'd be like, "Hi, my name's Haleigh. I do peer support. We got a referral saying you were having a hard situation, and I was just wondering if you'd be interested." We didn't go off of diagnoses. We even tried not to tell them we worked with Mental Health Association because there was such a stigma attached to the word mental health. I did that for a little over a year. The average caseload criteria is 25 clients per, well, individuals. They weren't clients there because that was a nonprofit, per individual. Well, I was there because it was a nonprofit without guidelines. My caseload started about 25, but it also very quickly crawled up, and we lost a lot of employees. When I started, I had 6 team members. Over the year that I was there, uh, within 6 months, we lost all of them but one. And then, so it was just me and one other individual. That individual had gone back to drinking, and after a few months was also not working. So I was the only person left on the team. I was navigating an 80-person caseload there towards the end, and it just kind of seemed like they saw that I was able to handle running the entire program without them hiring people to replace it. And so the weight just kind of continued to be put on me. A year prior, I had probably only been in peer support for 3 months. One of my coworkers at MHA went over to Centerpoint, and he told them about me. He also encouraged me to apply. I did apply that year prior, but I also didn't feel confident that I wanted to leave MHA yet. I felt like I liked where I was at, and I really cared about the real program that I was working in. So Centerpoint did offer me the job for $3 more an hour than I was making at the time, but I decided to stay with Mental Health Association. It was about a year and a half later that I was finally debating maybe I will see if Centerpoint still has that job offer. So I ended up applying. It was about the same time I was involved in some beta trainings. They're like law enforcement trainings to try to learn more about mental health and how to interact with people experiencing mental health. So I was getting to do that along with some LPD role plays. So what that looks like is our community providers go out and they do role plays with people who go through the academy, the new trained officers that are coming out twice a year, and we go do role plays. I am actually getting to do it. I believe March is the next time. I just got asked to do it again. Pretty neat for me to go and train law enforcement. Never thought they would want me training them. I started working at Centerpoint. It will be also 2 years ago in March. When I started, I was hired on for the peer support on the adult integrated care team. So what that looks like is I'm on a team. I'm on a team with a couple of case managers. I've got recovery support. We've got the health doctor. The health doctor kind of sits on all of our teams. Centerpoint's a whole health organization, so we have kind of all of the areas. So the doctor helps all of the teams, but then my team individually, each team individually has a peer support, 2 to 3 case managers, a therapist, and then our med providers also kind of go on to each team like the health doctor does. And so I do that. I do have a 25 person a week caseload now. I've been doing that. I've been in that role the whole time I've been at Centerpoint. A couple months after I started just wanting to know about the different programs. I wanted to learn all of them. I helped out with our street outreach program, just kind of shadowing it. That's going out and helping people experiencing homelessness and giving them supplies. That also looks like sitting in on hurt meetings, which is all the community providers just talking about our high concern individuals that a lot of us kind of are able to collaborate on and get better help and get their needs met better. After that, they were needing help in our crisis response unit. So what our crisis response is we get mobile crisis gets dispatched by either LPD, 988, Bryan Hospital, really any community provider can dispatch us out. Most of the time I feel like it's LPD or 988. And what that looks like is I'm on call for the weekend. So I'll work my regular office Monday through Thursday. And then I'm on call Friday, 5 p.m. through Monday at 8 a.m. Sometimes it's absolutely nothing. Sometimes it's nonstop. I go out and I respond with whoever the community provider is, or sometimes just by myself. due to my background with law enforcement, I'm pretty quick to wave them off and say I can handle the situation. Because a lot of times I can work through crisis with someone better once some activators have left the situation. Um, I'm very grateful that I've gotten the chance to do that. I got into mental health initially because I realized my son was probably likely going to have a lot of my mental health, and I'd never taken care of it. I have pursued, it's this last year that I've started to pursue more diagnoses and looking into medication for myself. We had a insurance change, so after we tried 6, 7 medications and none of them helped me much, I'm just back to my normal unmedicated self using my wellness tools and as my favorite, my sensory grounding tools, because a big part of my struggle is that I'm overstimulated. That's probably close to it.
Hey, thank you so much to Haleigh. The story was very well told, and I know it takes a lot of courage to tell that story, and you told it well, and it's very impactful. It's awesome how you've turned your life challenges into something positive for other people. And I know your story touches on a lot of the issues that our group here listening today are working with their patients, both substance use disorder issues, chronic pain, mental health. So we've got about 5 minutes. If anyone has any questions for Haleigh, you can speak up, drop those in the chat. We can just kind of pause here for a minute, see if any questions, comments come through. Yeah, a comment. Thank you, Haleigh. You were very resilient. Yes, I agree. I'll just kind of read the comments as they come in here. Thank you for sharing your story. What are your thoughts on what providers could have done differently to intervene or assist you earlier? Is there anything yeah, earlier intervention that could have helped you?
Um, I can't say for sure. Like I know people were trying. Like I know it was just kind of a matter of never figuring out what exactly my problem was. Like doctors always agreed there was something wrong with me, but they couldn't quite figure out what was causing all of my pain. I know that probably when I ended up on short-term disability was a pretty quick downhill spiral for me. That's what ended up bringing me back to the substances and bringing me back to the lack of finances, I guess, that probably had me in the situations that ended me back up in prison. Um, but I feel like that was just not having answers. I do wonder with the fact that, my MRI said in 2016 somewhat had a result that sounds like it could be the cause of all my issues, but that's always been considered not the cause. So I do wonder about that, but I'm still in the process of continuing to see providers, regular chiropractor, along with once I have more financial ability, more trigger point massage, because that just makes a world of difference. And normal massage does not help, but when someone knows how to go in and break up each of those little knots, I had one in Colorado last year that helped for months, and usually my trigger points come back in days.
We got a question. What is most important to you for staying clean?
My son. I'm very glad that I have a career nowadays that, for a long time, I thought nowhere was ever going to give me a chance. It was always going to be fast food or factory work or something that I never imagined Medicaid would pay for people to hear my lived experience all day. I don't know how familiar you guys are with peer support, but that's a job that's like, oh my gosh, you're someone with mental health and addiction, and you've experienced homelessness and you've been to prison. Those are all job qualifications. So I never imagined I'd find something like that, but I do feel like I'm in the right place. I also just got nominated to Leadership Academy at Centerpoint. I'm the first peer ever to make that. They do productivity scores. My productivity scores range from 105% to 147%, and I'm always at the top of the boards. So it's just the right place for me, and I get to grow every day and with my son, and he's just the best, even though he's definitely an energetic mess.
We got another question for you here. Thank you for sharing your story. In your experience with the residential treatment and community involvement, what do you feel is an area that needs to be improved that's under the radar?
I feel like they're starting to become more on the radar, but like just talking in a person-centered, trauma-informed way. Like a lot of times addicts or people experiencing mental health just get dismissed, especially that are experiencing pain. And I mean, there is a point to the fact that there's a chance my untreated mental health could be what causes all of my trigger points to develop. But just a lot of times addicts aren't heard, which I mean can be also for valid reason. A lot of times addicts are substance seeking, but it's just I think it's been good for me working at Centerpoint, learning the different ways of talking and about person-centered trauma-informed care.
Maybe we've got time for like one or two more here. Here's one. She says, it doesn't sound like you ever truly had the benefit of problem-solving court. Do you wish you think there could have been an opportunity with problem-solving court for things to be different for you?
Like with drug court, you mean?
With drug court, yeah.
Yep. It definitely, drug court actually did mean a lot to me. Even though I was in trouble the whole time and I self-terminated, when I go back to Norfolk, I still stop and see my drug court officer. Even though I made it hard for myself the whole time, I know that they cared and they have a lot of respect for me. I also, I had the same judge on all 6 of my felonies that I had. So, he was also the drug court judge. So they've also all kind of remained in my story. I know they could have given me a lot worse than 3 to 4 years when I went to sentencing. And even though it wasn't exactly what I had, intended in the situation, those people were there for me, and I did somewhat get the benefits of it.
Oh, good, good. Yeah, we've had some presentations on drug court here, and it sounds like it can be impactful for people.
Yeah.
Let's see here. Yeah, we can kind of end there. We've got a comment here. I'll just read it from Kelly. She says, "Thank you. We appreciate you sharing your story. You're a strong, courageous young woman. Sounds like you have taken a big workload. Please take care of you and your family." And yeah, I think we all feel that same way. And appreciate you coming on. And maybe we come back in a little while and hear an update from you. I think that'd be great.
Absolutely.
Yeah, thank you. So, and then for our participants today, there's a link to the evaluation survey in the chat there. I'll also be emailing that out. And then for our Echo team, if you guys want to hop over to that other link for a quick team meeting. And thanks again, Haleigh. Have a good morning, everybody. Thanks.
Thank you.
Thanks.